Good afternoon, everyone, and welcome to the second webinar of the FAWEC, the Farm Animal Welfare Education Center. Today's topic is pain and discomfort caused by parturition in cows and sows, and our speaker is Dr. Eva Mainau. Eva has been part of the FAWEC's team from its very beginning. She did her PhD on this topic, pain caused by farrowing and calving, and she has published extensively on this particular topic. Now, Eva will speak for around 45 minutes, and after that, you are more than welcome to ask questions. The idea is to close the session at about 5 o'clock in the afternoon. Please remember that you should send your questions via email to info@fawec.org, both during and immediately after the talk. So that's all from me. So Eva, the floor is yours.
Xavi, thank you very much for this introduction, and also welcome everybody. As Xavi just said, the title of this webinar is Pain and Discomfort Caused by Parturition in Sows and Cows. So here is the plan of the talk. I'm going to start with a little introduction, and after I'm going to explain different factors and consequences affecting pain caused by parturition. After that, I'm going to spend the major part of this talk explaining the different indicators in order to assess pain caused by parturition. And finally, we summarize a little bit the different treatments that we can do around parturition, and finally, a little summary. So we can start with this introduction. It is well known that the definition of animal welfare is based on the principle of the 5 freedoms. This principle takes into account different factors such as feeding, housing, health, behavior, and the emotional state of the animals. In terms of health, it's necessary an absence of pain, injuries, and disease. So it's clear that one of the components of animal welfare is pain. So that means that veterinarians and producers, we have to be able to recognize and prevent this pain in animals, and also we have the ethical responsibility to treat these animals. So there are the different definitions of pain, but probably the most used one is the definition by the Association for the Study of Pain. So pain is an unpleasant and sensory and emotional experience normally associated with tissue damage or described in terms of such damage. Regarding this definition, I would like to remark 2 aspects. The first one is that pain can be caused by trauma that directly damage the receptors of pain, called also nociceptors. But also pain can be caused by inflammation, infections, or ischemia. For example, in the case of inflammation, there is the release of different mediators such as prostaglandin and bradykinin that potentiate the receptors of pain. And also, the second thing that I would like to remark from this definition is that pain has a sensory component, but also pain has an emotional and affective component that it is very difficult to assess, at least in animals. So parturition is defined as acute, nociceptive, somatic, and visceral pain. And from a questionnaire in parturian labor, 15% of women reported that no pain or little pain was experienced during labor, Contrary to that, 75% of women reported from a moderate to a very intense pain during labor. In animals, a questionnaire performed in cattle practitioners, they ask to rank different procedures and conditions in adult cattle. So these veterinarians rank dystocia with a value of 7 over a scale of 10. Only other procedures such as claw amputation or cesarean section receive a higher value of pain compared to dystocia. So regarding these questionnaires, it's clear that pain it's painful not only in women but also in animals. Here I'm going to describe the different physiological stage at parturition. Traditionally, the first stage of parturition is characterized by the dilatation of the cervix, the myometral contractions, and also the placement of the fetus for extraction. Myometral contractions vary from species to species and also vary from individual to individual, but in general becomes more regular 12 hours before the second stage. Also, in this first stage, it's important to know the physiological changes. In this first stage, there is an increase in estrogens and a decrease in prostaglandins. In the second stage of parturition is characterized by abdominal contractions, allantochorionic sac rupture, and the expulsion of the fetus. This second stage is characterized also for the release of oxytocin from the posterior pituitary. Oxytocin is an hormone very important for the onset of the maternal behavior, and also oxytocin is very important for the myometral contractions. And finally, the third stage is characterized by the expulsion of placenta. Here, I would like to differentiate between polytochus and monotochus species. So, polytochus species, such as sow, void their placenta together with each piglet. Contrary to that, monotochus species void placenta after the birth of the calf. Now, regarding this physiological stage, I'm going to describe the kind of pain in each stage. For example, in the first stage is typical or predominates the visceral pain. This visceral pain is transmitted from T10 to L1, so that means that thoracic and lumbar areas are affected. Specifically, pain arrives to the abdominal wall, lumbosacral region, iliac crest, and gluteal area. It's characteristic from visceral pain that is normally very bad localized and normally is a diffuse pain. During the second stage is characterized by a somatic pain. This somatic pain during parturition is transmitted from S2 to S4, so here only the sacral segment is affected. Specifically, there is the distension and traction of pelvic structures and also the perineum. In the somatic pain, contrary to the visceral one, normally is very localized and also is a sharp and continuous pain. During parturition, I would like to explain that in cows and sows, and also, of course, in women, for example, in rats, there is a mechanism called pregnancy-induced hypolgesia. This mechanism is that during the late pregnancy and parturition, there is an increase in nociceptive threshold. So there is a decreased sensitivity to painful stimuli. hypolgesia perhaps appears as an endogenous defense against the pain of parturition. And this mechanism is mediated by endogenous opioids, and specifically during the parturition, the uterine distension and cervical stretching through hypogastric and pelvic nerve increase the concentration of dynorphin. So dynorphin is the most important endogenous opioid during parturition, and opioids act on the kappa receptors and consequently produce analgesia. But also the physiological changes during parturitions, such as the increase of on estrogens and the decrease of prostaglandin or progesterone, also increase the dynorphin release. So it is well known that in general, endogenous opioids or opioids with high concentrations may inhibit the release of oxytocin. And as I said, oxytocin is a very important hormone for parturition. So although more research is needed in this aspect, we have to consider the risk of increasing nociceptor at birth as a negative feedback to oxytocin release. And also in terms of hypolgesia, at least we can say that in cattle also hypolgesia can be produced for the ingestion of amniotic fluid. And the molecule responsible of this hypolgesia is a molecule called placental opioid enhancing factor, so the POEF. The idea is that this molecule has two important things to remark. The first one is that POEF produces more opioid effect without adding more opioids. So that is important because produce analgesia effect without increasing the risk of producing negative effects to an inhibition of oxytocin release. And the other important thing to remark is that the POEF activates the delta and kappa opioid receptors, so produce analgesia, but attenuates the mu opioid receptors. So that's important because in this way, the side effect, for example, of constipation is reduced during parturition. So after this introduction, I'm going to explain some factors affecting pain caused by parturition. Here we have to know the definition of autosial. So autosial is a normal parturition with a normal duration, and as we previously see, that it's a cause of pain. Contrary to that, we have the dystocia parturitions. That means that this is a difficult parturition resulting from prolonged normal parturitions or prolonged or severe assistance extractions. In this case, dystocia or difficult parturitions produce a high level of pain. In cattle, there are different ranks of dystocia, different scales that can divide the different dystocia or pain at parturition. And here we have an example of a 5-point scale regarding the traction pressure applied in cow. So from a minimum pain to a maximum pain, we can observe non-assistant calvings, easy manual pull, so that means that the farmer or veterinarian pull by hand, the hard manual pull that normally we can use a rope, the mechanical pull when we use a puller, and finally the most painful one, the cesarean section. So regarding the definition of dystocia, it's clear that one of the factors that can affect pain during parturition is duration. So the duration of parturition, the normal duration of parturition in sows, it's around 2.5 hours, and in cows is from 30 minutes to 4 hours. So the idea is that in general, parturitions longer than this normal duration will receive high levels of pain in the mother. And there are several factors that can modify this duration. For example, breed, the number of newborns, the presence of fetal mortality, several aspects such as climate or temperature, and also the body condition score of the mother. And of course, there is another factor that is parity. That it's very important because it is well known, or in general, it is assumed that normally primiparous mother has a longer duration of parturition than multiparous ones. So in general, we can say that primiparous mother has a high level of pain during parturition. It's true that there are other factors that there isn't a clear agreement between studies that also need more research. So, for example, factors that can modify duration of parturition are birth weight, the induction of parturition using prostaglandin, the gestation length, and finally the exercise. This last factor is important because the current European legislation on pig welfare is obligatory now that sows allocated in pens during gestation. So there are some evidence that allocating sows in pens during gestation increase their muscular tone and has shorter parturition. And if we remember the definition of dystocia, we said that is caused by parturition longer than normal, but also are caused because some parturition need several assistants. So here we have two examples in cattle that consider this severe assistance. One factor is the fetopelvic disproportion. This fetopelvic disproportion is higher in primiparous than multiparous one, and also is the main cause that veterinarians perform a cesarean section. And the second factor is the fetal malpresentation. In this case, is higher in multiparous than primiparous one. And both of these causes can have one of the risky effects, that is the fetal gender. So in general, we can say that males have twice risk than females to experiment the fetal, for example, malpresentation. Now I'm going to talk about the principal consequence of pain caused by parturition. So parturition itself, and of course the difficult or dystocia ones, it's a risky process for the mother and also for the newborn. In the case of the mother, there are several implications around parturition. For example, there is a decrease on body weight, feed intake, and milk production. Also, the probability to increase health problems during parturition increase. For example, endometritis, vulva discharge, or retained placenta. And also, around parturition, increase the probability that an animal or a female die. For instance, regarding a study in sows, they described that the overall sows that die at farm level, that it's true that is not very high, but the overall of those sows, 42% of sows die around parturition. And in the case of cows, parturition is a risky factor, so the mortality may increase 4%. And also, in the case of the mother, at least we have another effect that is the increase of stress. And I'm going to talk about this stress in the next slide. So at the end, we say that parturition can affect the mother, but also can affect the newborn. And that's true because the dystocia or difficult calving increase the probability of neonatal mortality. In terms of stress, we know that around parturition increases stress because there is an increase of concentration of cortisol. So the reasons, there are different reasons and different factors that can explain this stress. And the first factor is the parturition itself, because it's known that normally any process that is painful normally causes stress, and also because any process that is new or infrequent also produces stress. And also there are other factors such as environment stressors that can increase this stress around parturition. And a clear example of that is sows located in crates. So the idea is that sows located in farm crates in intensive conditions, they not able to perform the nesting behavior before parturition. And nesting behavior is an important behavior that has to be performed for the sow before parturition. And that increase the stress because increase the percentage of plasma cortisol. And finally, also parity is another factor because it is we normally assume that primiparous mother normally has more stress than multiparous ones, and the reasons are different reasons. There are different reasons. Normally it's because there is a new experience, and also, for example, in the case of sows, is because probably is the first time that a sow is allocated in a farrowing crate. So the idea is that we have several stressors, we have several factors that can increase stress. And here it's important to remember that stress has an additive component. So as more number of stressors are present, more pronounced will be the mother's stress. And by now, it's an animal welfare problem, or so the increase of stress, it's an animal welfare concern, but also it's a productive concern, because the increase of stress through endogenous opioid produce the inhibition of oxytocin release. And as I said, oxytocin is an hormone very important around parturition. So if we have the inhibition of oxytocin, it will be longer parturitions, and consequently can increase the neonatal hypoxia and also the exhaustion of the mother. And also, if we have the inhibition of oxytocin, probably the maternal behavior is not appropriate, and the risk of have rejections or, for example, aggressions increase. And finally, oxytocin, it's very important for lactation. So an inhibition of oxytocin can produce an inhibition of milk ejection. So the idea is that if we can control as more as possible these different stressful factors, probably we can improve, we can reduce this stress around parturition, and we can improve several aspects during parturition. And now I would like to try to give some recommendations at farm level regarding this kind of stress occurring around parturition. So the idea is that in general, in cows and sows, it's necessary to avoid stressful situations. For example, competition for the food, water, or place to down. And also it's necessary to reduce the noise or the high temperature or uncomfortable floors. We recommend move the mother to their new parturition room several days before it, in order that the mother recognize the new place several days before parturition. Also, we recommend to introduce enrichment material that is important, especially in sows, in order that they can perform the nesting behavior properly. We recommend supervised parturition without disturbing the mother, and it will be necessary a minimum intervention. And this intervention, it's very important that there is a good human-animal relationship in order to decrease fear and stress of these animals. And finally, we recommend to permit a good maternal-filial contact. And that is the case, for example, in cattle. We recommend that cows can ingest the amniotic fluid. And now I'm going to start with the different pain indicators, so the assessment of pain caused by parturition. So the principal question for the assessment is how to measure pain in animals. And it's known that there isn't any specific or direct parameter. There isn't any single parameter that indicates pain in animals. And also in animals, we don't have a golden standard. So the idea is that we have to integrate several indirect parameters. And also, in this way, we can obtain different scales in order to assess pain. In order to assess pain in animal, we have basically three ways. We have the general indicators, the physiological indicators, and the behavioral ones. In relation to general indicators such as food and water intake and weight gain, we have to say that normally are very inspecific, because other causes other than pain can modify these indicators. Regarding physiological indicators, on one hand, there is the activation of the sympathetic automatic nervous system that produces, for example, an elevation in cardiac rate, respiratory rate, and body temperature. And on the other hand, there is the activation of the hypothalamic pituitary adrenal system that produces, for example, the elevation in cortisol release. And again, these physiological indicators are very unspecific, because there are other causes than pain that can modify it. So, for example, chronic stress can increase cortisol release, or an infection can increase rectal temperature. And finally, we have the behavioral indicators that are the most used ones in the different studies of pain. And here, what we have to do is observe a change in the frequency of normal behavior, and also we have to observe the presence of abnormal or atypical behavior. So now the idea is to take these different kind of indicators and to try to put some examples at parturition level. So, for example, here we propose that for general indicators, in order to assess pain during parturition, we can observe food intake, water intake, and milk production. In terms of physiological indicators, we can observe body temperature, or, for example, also we can observe aptoglobin. Aptoglobin is an acute phase protein, and is produced by inflammation. So, in consequence, also can be a possible indicator of pain. And finally, in terms of behavioral indicators, we have different indicators such as activity, body postures, duration of parturition, and also different specific behavior such as rooting or kicking. And here I would like to remark that apart of observe different indicators on the mother, also we can observe this kind of general physiological and behavioral indicators on the neonate, because neonate also can provide information on the degree of parturition difficulty. And here, more specifically, we have an example of general indicators around parturition. First of all, it's important to say that a normal or autosia parturitions normally produce a decrease on food intake and also a rumination in cattle. But despite of this, there are several evidences that in dystocia or postpartum problems such as retained placenta, mitritis, or ketosis, there is a dramatical decrease on food intake. So the idea is that a dramatical decrease on food intake can demonstrate as that this parturition is more painful than the normal ones. And the explanation, apart of pain, also there is in cattle another one explanation, and is that in the case of the fetopelvic disproportion dystocia, that this kind of problem can reduce the amount of space available in the rumen. In relation to the physiological indicators around parturition, again, we have to remember that there are several physiological changes normally produced by a normal or autosical parturition. But despite of this, also in dystocia, there are several authors that describe, for example, a dramatical increase in progesterone or vasopressin and also in aptoglobin that can indicate dystocia or problematic parturitions. In the case of the cows, the two possible physiological indicators are the CRP and also the aptoglobin. Regarding aptoglobin, I say that is acute phase protein that can indicate inflammation. Here you can observe one study performed in our group, so here in Barcelona, and we can observe that we found in cattle after parturition a higher concentration of aptoglobin during day 2 and 4 compared to day 0 and 15. And also in all the days observed, heifers or primiparous cows presented higher concentration of aptoglobin than multiparous ones. So again, probably aptoglobin, and in the case of heifers, can explain that there is a higher level of difficulty or higher level of pain during parturition. In relation to the behavioral indicators around parturition, again, it's important to remember which is the normal behavior around parturition, because, for example, a normal parturition produces an increase on restless, as that it's supposed that is normal, and also there are other behavioral changes, for example, exploring, that also increase. Despite of this, in cows and sows, the major part of studies describe that dystocia or difficult parturitions presentate or have a dramatical increase, an increase more than normal on the number of position changes, and there is a lower number of duration of lying posture, and that may be indicative of dystocia. And also there are, in cows, there are other specific behavior that also the modifying the frequency, we can assume that indicate dystocia. In this case, there is not a real agreement between studies, and maybe this no agreement is because different authors observe different times around parturition, and also because this kind of behavior shows a very high variability. So, for example, a higher than normal increase in tail-up behavior, or in lying laterally with the head rested can indicate dystocia. Or, for example, a lower time spent eating, or a lower time performing, or a lower number of events performing self-grooming can indicate dystocia. And here I just explained several scientific evidence, but the idea is, or the question is, what we can do at farm level. So in cows and sows, probably the best indicators that we can use at farm level are an increase in number of position changes, a decrease in duration of lying posture, and probably also a decrease in food intake, in quantity and also in time that animals spend in the feeder. And probably in the future, it will be necessary, or it's a possibility, to install a different automatic device in order to register this kind of different change of activity. And also at farm level, I would like to remark the tail-up behavior, not only as a probably indicator of dystocia, but I would like to remark this behavior because we think that it's a probably good predictor for calving. So from one study performed in our group, and according to other authors, at least during 6 hours before calving, you can observe of the majority of the cows the tail up behavior. So that it's a good indicator that calving approach. And we think that probably is that one of the most useful indicators, because it's easy to detect, because you only need little time or specific moment to observe the animals. And also, a part of the general indicators, physiological and behavioral indicators observed on the mother, also it's important to observe the neonatal, the newborn. So the idea is that dystocia can be demonstrated also if you observe a newborn with a less vigorous or less vitality. In fact, a study from Barrier said that dystocia was demonstrated or was observed because a calf spent higher latencies to attend to a stand, walk, and reach the udder. And the explanation of that, the principal explanation of that, is that calf probably born with a longer parturition of calving, and that produced the hypoxia or asphyxia of the calf, and consequently there is a metabolic acidosis and can produce the inability to thermoregulate and reduce motility in the newborn. Other causes that can explain this effect on the newborn are presence of traumatic lesions and obstetricial intervention. And finally, in order to finish this part of the assessment, here I would like to share a study that we performed in our department. Here we obtained a pain scale in sows after farrowing. In this scale, we perform principal component analysis, and we obtain different indicators that may indicate more painful parturitions. And the thing is that this scale there is indicators related to the mother, and also there are indicators related to the newborn. So you can say that duration of farrowing, posture of the sows, activity of the sows, but also, for example, the piglet presentation. So that means that if piglet was born with a head or a back presentation, and piglet vitality, seems to be important components and important factors in terms of pain during farrowing. And the idea is that when you obtain scales, you can obtain a number or a rank for each animal, and you can classify the sows according the pain that suffered during parturition. And here I'm going to summarize a little bit the treatments of pain caused by parturition. So in general, for the treatment of pain, we have the local anesthesia, the alpha-2 agonists, and the anti-inflammatory drugs. And from a questionnaire in UK and New Zealand, we observed that veterinarians said that the most used drug used in dystocia and cesarean sections was the non-steroidal anti-inflammatory drugs. And the most used non-steroidal anti-inflammatory drugs were meloxicam, ketoprofen, and flunixin megluvine. Contrary to that, it seems that farmers don't use a lot this kind of drugs, and probably the reason is the cost, or also the inappropriate withdrawal time, or finally, maybe is the inability to appreciate the level of pain. And regarding the mechanism of the non-steroidal anti-inflammatory drugs that probably you know, is that this kind of drug actuates over the cyclooxygenase enzyme. There are two kinds of COX. The COX-1 produce physiological changes on the physiological prostaglandins, so that means that produce side effects. And contrary to that, COX-2 produce the changes on the pathological prostaglandins, and is in these cases when we can observe the anti-inflammatory, analgesia, and antipyretic effects of the non-steroidal anti-inflammatory drugs. And regarding the different studies using non-steroidal anti-inflammatory drugs after parturition, we can say that any study found differences on food intake or milk production, and also any study found differences on the physiological indicators. Moreover, it's necessary to say that flunixin megluvine administered after calving increased the probability of retained placenta, and probably that is one of the consequences of the side effects on the decrease of physiological prostaglandin. And more specifically, here we have a study in cows from newbie that demonstrate that the administration of meloxicam increased the number of feeding visits and also increased the total time spent feeding. And finally, a study performed here in Barcelona, we administered meloxicam in sows after farrowing, and we observed that sows recovered their normal behavior sooner. And also we found several productive good consequence. So the piglets has a higher average daily gain during lactation. So now I would like to read some summary of this presentation in order to be clear which are the principal ideas. So parturition, we explained that parturition itself is a painful process. Also, we explained the hypolgesia performed during late pregnancy and also during parturition, and perhaps that appears as an endogenous defense against the pain of parturition. We explained that the principal factors affecting parturition pain are parity and dystocia, and also there are other factors associated to that, are the longer parturition, the fetal-pelvic disproportion, and also the fetal malpresentation. We explained that parturition is an intrinsically risky process for both mother and the newborn, and that causes a stress response and also health problems and neonatal mortality. We can see that the behavioral indicators seems to be more valid than general or physiological indicators for assessing pain around parturition. And finally, we say that the administration of a non-steroidal anti-inflammatory drug following parturition has to be taken under consideration. So my last point, and also in order to try to give you some ideas, I would like to remark that two important points. The first one is for the point of the education and training. We think that it's very important that veterinarians and producers increase the knowledge of the different indicators, for example, of pain or the difference management. And also, we know that the good human-animal relationship, at least during parturition, has an important effect. So we know that veterinarians and producers has to increase their education and training in general in order to perceive this issue. And also, a final point is that we think that is necessary more research, and specifically the principal points could be a major understanding the pain mechanism involved in parturition. Also, we think that we need better and easy pain indicators, and also we have to make efforts to obtain pain scales. And finally, we need more research on the impact and also the cost benefits of the administration of non-steroidal anti-inflammatory drugs. So thank you very much for your attention. And now, if you want, it's time to perform some comments or questions.
Okay, thank you very much, Eva, for your talk. And we already have received some questions. I would like to remind you all that if you have any further question, you are welcome to send it to info@fawec.org as soon as possible. We will carry on until 5 p.m. Roughly. Okay, so let's start with a very practical question. It is a rather long one, so I will try to summarize it a little bit. Eva, you have given several examples of the benefits of using painkillers to reduce the pain caused by calving and furrowing. Now, question is, in practice, would you recommend using anti-inflammatory drugs, so painkillers, in all females at parturition, or just in some cases? What is your view on this?
Okay, thank you very much for this question. It's a very interesting one, and also it's very compromising. So I think that in case of dystocia, or in case that we have a real painful parturition, and also of course in case of cesarean section, yes, it's necessary to use some painkiller. So it's necessary to use anesthesia or alpha-2 agonist and or non-steroidal anti-inflammatory drugs. A part of this kind of dystocia or more complicated parturitions, for a normal parturitions, I think that probably we don't have enough evidence that a painkiller after parturition can help enough the mother and can help enough the newborn. It's true that there are some positive benefits, but I think that we need more research in terms of probably the relationship between the cost benefits. So the idea is, in normal parturition, I would like to wait a little bit and to try to perform some studies that relation the benefits that support some kind of analgesia after parturition and the real cost of this treatment. So it depends. For dystocia and cesarean, yes, it's necessary to treat pain pain is it's very high, so the answer is yes. And for normal ones, we have some benefits, but systematically we need more research in terms of economical benefit.
Okay, thank you very much. Now we have another one which is also rather practical on the effects that pain may have on production. Now, one of the main worries, if you want, in practice, is to make sure that the newborn gets enough colostrum. So, are you aware of any evidence suggesting that pain at parturition may have negative consequences on colostrum intake or colostrum production by the mother?
Yes, the idea is that pain, as I just explained, pain by the endogenous opioids can produce an inhibition of oxytocin release, and in consequence, oxytocin is very important for milk production. So that it's very important also for the immunoglobulin transfer. So in the theoretical point of view, yes, pain can affect this transfer of the immunity. And in fact, now I would like to remark one study that we performed in our group that is not yet published, but maybe here you can give you a better understanding of that. The case is that we administrated non-steroidal anti-inflammatory drug after farrowing, and we not only observe the sows, we also observe the piglets, and we obtain serum from this kind of piglets. And the result is that piglets treated by meloxicam presented a higher concentration of immunoglobulin than piglets from sows treated as control. So we don't know exactly which is the mechanism. We don't know exactly all of the steps, but probably using non-anti-inflammatory drugs can reduce the inflammation and at level of the mammary gland, and in consequence, probably the immunoglobulin transfers increase to piglets.
Okay, thank you. Now we have one question which is related specifically to cows. Actually, it's two questions in one. What is the benefit of amniotic liquid intake in the cow? And related to this, is there any reason to allow maternal-filial contact in cows?
Sorry, Xavi, can you repeat the two aspects? Yes.
Yeah. The
okay.
First,
sorry. Yeah.
One of the questions
yeah.
is whether intake of amniotic fluid by the cow has any benefit, and the second part is whether it makes any sense to allow contact between the cow and the calf immediately after birth.
So yes, as I explained, the ingestion of amniotic fluid have this a kind of molecule that produce analgesia. So that is demonstrated not only in cows, that is demonstrated also in rats, that the ingestion of placenta and also the ingestion of amniotic fluid can produce this kind of analgesia in the animal. So yes, I think that there is a real benefit because you increase the degree of analgesia during parturition. That specifically means hypalgesia during this time. And the other thing that I would like to say here is that in the case of cows, we observe this analgesia benefit when the animal ingests amniotic fluid, but we don't observe this benefit when the animal ingest placenta. And that is probably because the ingestion of placenta normally occurs like 4 hours after parturition, and probably this kind of molecule don't have enough effect.
Okay, thank you. Now, another one related to cows as well. What is your view on the isolation of cows for calving? Would you advise doing it, and if so, for how long, in groups or individually? What are your views on this practice?
Yes. Is that cows, it will be nice that they calving alone, so in a specific calving pen. So the idea is that, for example, 1 or 2 days before calving, you have to move the animal in a specific room for calving, and that it's important because cows can be very quiet, and also has a very good maternal behavior. It's true that this isolation also it will be nice that the animal at least has contact, visual and olfactory contact with the other animals. And this isolation it's important in terms of management, because farmer can observe very easy this animal that we separate for calving. And also it's true, at least in Spain, it's not very typical have a lot of calving specialized rooms. So normally here animals around parturition or before parturition are allocated in groups. In this case, we recommend a maximum or 30 or 40 cows in each pen. And another good idea is that before parturition or when the parturition starts, you can separate this animal inside of the same pen, or inside of the same group of animal, but you can separate using barriers the animal that is starting calving. So in this way, you can supervise and you can pay attention on the specific needs of the mother.
Okay, thank you. Now it's almost 5 o'clock, but I think we can squeeze in just another question. In practice, sometimes we have the impression that females which show poor maternal behavior may do so because they have gone through a very painful parturition. Now, is there any evidence that actually shows that pain may reduce the quality of maternal behavior?
Yes, as I explained, theoretically, pain during calving can produce reduced or a bad maternal behavior, and it's true because I explained the physiological, behavioral, and general indices in order to assess pain in the mother and also in the newborn, but I didn't explain the relationship between the mother and the newborn. So a priori, yes, it's a good indicator, but as I can remember, there are some studies that try to prove that, and at least in cows, that was very difficult because at commercial level, it's very difficult that the farmer don't place the calf in front of the cow, and the presence of the calf in front of the cow is a very motivation for the recovery of the mother. So it's difficult to try to demonstrate this link. And also, now I remember in sows, it is demonstrated that, for example, this kind of rejection or this kind of savaging behavior, that means that the cow kill piglets. One of the hypotheses that this behavior occurs probably is not only the stress, but also the pain during parturition. So in summary, yes, the maternal-filial behavior can be a good indicator, but also it's true that it's difficult to demonstrate it, and we need a lot of animals in order to demonstrate this behavior.
Okay, thank you. And just the very last one, how many days would a cow experience high level of pain after calving or cesarea? And what would you recommend as the duration of the treatment?
Okay, in case, I'm not really, sorry, but I'm not really an expert in terms of cesarean section. We concentrate our efforts on normal parturition and also dystocia ones. But I think that for cesarean section, that pain may last at least 15 or probably 1 month. Sorry, I don't know exactly. And in terms of treatment, I think that I have to say that of course it's necessary the anesthesia. So of course it's necessary that when you perform it to apply anesthesia and other analgesia, and also it's necessary to introduce some analgesia after cesarean, and probably is in the same rank. If the pain lasts, for example, 15 days, I'm not sure about that, so it's necessary to apply this treatment at least, I don't know, for example, 1 week, I don't know.
In case of normal parturition, do you have any idea of the duration of pain?
In the case of normal parturition, yes, we can talk, for example, that this pain may last about 1 week. So the most important or painful days are the first and the second day, of course, but there are several evidence that there are some complication and some pain consequence that may last during 1 week.
Okay, well, thanks very much. I think it's time to draw this webinar to an end. Thank you very much, Eva, for your presentation and for answering all the questions. Thank you all for being with us this afternoon. And please visit our web at www.fawec.org so that you can be updated on our new developments. So thank you very much and good afternoon.